Hey, it's Dr. Amanda with Straightsmile Solutions, straightsmilesolutions.com, and today we're going to talk about yellow light case selection for general dentists. Yellow light means that for me, it's for dentists who have done at least and finished at least 50 aligner or braces cases. It doesn't mean started, it means finished optimally. And they feel like they can tackle it, or dentists that are willing to work with an orthodontist to help them. We do this at Straightsmile Solutions. We'll help you with your cases, but there's a lot of other orthodontists that do too. So you want to get orthodontists that are, of course, US licensed. That's really, really important. There's a lot of orthodontists that are doing this in foreign countries. I do not recommend that. US licensed orthodontists who are trained in removables and fixed, who have the time to sit down and help you with your cases. So this would be the yellow light cases. This is not something you want to tackle on your own unless you're very, very, very experienced and you've finished at least 50 cases ideally. So this is a little bit of what we're looking at. So a little more complex, building on the green. So make sure you watch the green video first, and then we're going to talk about yellow. So this would include slight class 2 cases, molar or canine up to 4 millimeters, not full step class 2, slight class 2. Obviously, in teens or growing kids, for these type of cases, you might be using MA, you might be using twin blocks, you might use elastics, most likely not. In adults, we might do sequential distalization, we might do elastics, we might do IPR. Obviously, it's going to depend on the sagittal slice of the CEF. We're going to have to check that, you got to be, if you're going to take these type of cases, you need to have a way to either take a sagittal slice CBCT or a CEF on every single patient. If you do not have that ability, you should not be taking yellow cases. And this I really have to hammer home, because there's a lot of dentists who have skills, but they're not getting the right diagnostics. That opens you up to liability because you're just guessing on the treatment plan. And a lot of times these dentists are asking me to help with their cases, and I'm like, I don't have x-ray vision. I don't know. I don't know what the right thing to do here is. Most orthodontists take CEFs standard on every single patient, just in case we need to refer back to it, and also for standard of care. All right, what else? Edge-to-edge cases, anterior crossbite only, not posterior crossbites, okay? So that means we either have just edge-to-edge. I'm not saying a full anterior crossbite, edge-to-edge. That means the front teeth are hitting, boom, boom, right on top of each other, okay? Those are easy. I mean, we either do a ton of lower IPR, or we take out a lower incisor, or we make sure the third molars are out, and we slide the teeth back. Deep bite and overbite cases, any severity. So we'll take whatever, 100% deep bite, fine, no problem. We can handle that. We can take a minor open bite up to 2 millimeters, as long as you know the etiology of the open bite, what caused it. You can't guess, you need to know, which means you're either going to have to send your patient to OMT, to a sleep specialist, okay? You have to do the OMT workup yourself, but then know about the treatment. This is most likely going to involve OMT. If you don't know what OMT is, you need to go through my whole OMT playlist. You can go to my YouTube channel, put in the search bar with the little magnifying glass, letters OMT, and all the videos should come up. If anything I'm mentioning you can't find within my channel, you're more than welcome to email me, info@straightsmilesolutions.com. Go to my website, straightsmilesolutions.com, send me a website message and I will give it to you. No problem. So you need to know what caused it, and that cause has to be fixed before you get started. Like the OMT says it's okay for you to take this case. Remember, OMT is going to add a couple $1,000s onto the case unless you're offering OMT services in your practice, which you can. It's not hard. You can get your hygienist trained in less than a month. I think someone's even less than a week if they really go for it. And you can start billing for that. Insurance not going to cover, so it's cash, but the OMT treatment or the habit treatment needs to be completed, and that is not patient's word. That is someone actually evaluated it, signed off saying that the habit is gone. There's still an open bite because of the habit. Any patient that has an anterior open bite either has a habit that needs to be fixed or needs jaw surgery. There's no other way around it. And I can't say this enough times. Any patient with an anterior open bite, you can't go straight into Invisalign. You can't go straight into braces. It will relapse and weird things will happen. Sure, they're going to make a Clin Check for you, but it's not going to happen. I can tell you that. And it's not going to retain. So I'm going to keep saying this again. Any patient with an open bite must finish their OMT therapy and get a sign off from the OMT. A sign off in writing saying the habit has been eliminated. Unless you have that from their OMT, not them saying it's gone, then you can go ahead and proceed. Otherwise, it is a jaw surgery case and you got to punt that out. All right. We'll take a patient with mild periodontal disease with some attachment loss that has been treated. It's under control, less than 3 millimeters of attachment loss, which means this is going to take you up to people in their 40s and 50s, possibly 60s, probably not older patients, sometimes younger. You've also done a 1-month evaluation, completed and charted, and all pockets are less than equal to 3 millimeters and no major mobility. Okay, so mild perio, mild. Anything else is now a red light, okay, which is not something you should be taking. Weird things can happen and do happen. We'll take posterior crossbite cases in kids and teens. 13 years old, it could be 14, 15, but in kids and teens, because we can fix those. Now you're going to have to do some type of additional treatment, so you should definitely consider taking a phase 1 course. We do have one available. I have some promo codes that might still be available. Feel free to contact me. It's very affordable, and you get 13 CE units. In addition, you can take mixed dentition cases. Kids and teens that haven't lost all their teeth, still growing, lots of things we can do there. Very easy. Fix the growth issues first, fix the bites first, move on to straightening teeth. Not hard. You should not be afraid of those cases. These yellow light cases include a lot of potential cases. That's probably 50% of your practice. It's going to increase your starts significantly if you're willing to do yellow light. But again, you have to have a lot of experience or you need to be working with an orthodontist.